Hi everyone, I'm Sierra White, and I'm going to be talking about critical thinking in nursing. Um, we're just going to talk a little bit about how we develop our skills for critical thinking, um, and how moving from our ADN to a bachelor degree, we're able to become more knowledgeable and then in turn be more safe and efficient in the workplace with our critical thinking. The first slide, I just listed the course competencies for this week, which you've probably already read through. Um, first, first thing, what is critical thinking? As I did my research, I realized there are many, many definitions for critical thinking. The one that I chose to put here is from our book. It says critical thinking is informed, purposeful, and outcome-focused thinking that requires the ability to identify problems, issues, and risks and make judgments based on evidence. So when you first look at that, it's kind of overwhelming maybe. And I think that after we go through how we can be better critical thinkers, you'll be able to put this together and it'll make more sense, hopefully. So, education on critical thinking. One paper that I read stated entry-level nurses, whether that's ADN or BSN, after graduation, the nurses are unable to meet expectations for critical thinking and clinical judgment. And why that is mostly is students aren't really given the opportunity to practice in school because you have limited clinical time. It's hard to practice critical thinking without the actual situation taking place. And I noticed that too going through school. It's hard to make it feel real. So many nursing programs use simulation labs to test and practice clinical thinking and clinical judgment. Most of the time, students are able to work in groups, which is helpful because a lot of times students learn from each other, which we know our discussion boards are a lot like that. We see what everyone brings to the table, and we've all come from different backgrounds, and we all think very differently. So it's nice because I'll read something and I'll write my response, and then I'll read other people's responses, and I notice how they've come from a different angle completely, and I never thought of that until I read their posts, which is really nice. So I learn from you guys, and I hope that you learn from me too. And we as nurses, we do a lot of working together, and I think that that's the best way to do things. So that's that. So one way that we can learn how to better critically think is to use the nursing process, which we've probably all had crammed into our heads through our programs in the past. So, of course, the first part is assessment. So you need to assess your patient, assess what the problem is, the situation. We need to have a purpose to critically think. So what's the problem? Then analysis or diagnosis. We need to watch for trends, patterns, try to identify a nursing diagnosis if we're able to. We also want to look through charts. We want to look through past data on that patient to just get a good round picture of what's going on, what's normal, what's abnormal. And then planning. Obviously, care plans are what nurses do. Come up with a nursing diagnosis, decide what the goals, outcomes are, working with the patient, of course, what are their goals, what do they want to accomplish, and then what do we need them to accomplish for them to possibly go home or to get them to their highest level. And then nursing interventions, what are we going to do to help them? Implementation, follow the care plan that you wrote, make appropriate changes as needed, and then, of course, chart how it works, if it works. and that goes in with evaluation too. So that is one way that we can kind of work through our critical thinking, is to think of our nursing process. It's a good system to follow. The critical thinking model, so according to our book, there are 5 components of critical thinking. They are specific knowledge, experience, competencies, attitudes, and standards of care. So knowledge. Nurses have to have a good knowledge base to be able to properly make clinical decisions, which we know, which is why we go to school. We need to gain knowledge about the physiologies and all of the things that we're going to experience in the workplace. Not that you can learn everything that you're going to experience, because a lot of that comes with experience, which is the next one. The more time you spend on the floor, the more time that you work with the certain types of patients that you're working with, perhaps. I know that nursing home experience is a lot different than ER, a lot different than OB. So wherever you're working, you're going to gain your experience, and you're going to be able to make better decisions in that specific area that you're working in. Competencies. Nurses should be comfortable with scientific process, generating hypothesis, problem solving, and decision making. Obviously, if we're going to critically think, you need to be able to do all of those things efficiently. Then attitudes, or known as traits of the mind. So like I was talking about earlier, we all have a different way of thinking. We were all raised very differently, and we all come at things from a different angle, which is good. So when you're working with groups of nurses, it's nice because they might have ideas that you would have never thought of that actually work better or are more safe and efficient. And then standards, which is a lot like the Nursing Code of Ethics, where we do no harm and are always working towards the good of the patient the safest way possible. It's good. One thing I found interesting in our book was characteristics of a critical thinker, and I thought that these were notable. So be open-minded, be humble. You're not always going to have all of the answers. Don't be afraid to ask your fellow coworkers. Be a team. Be proactive about things. You know, if you think something is going wrong, it probably is. There's, intuition. We all get that gut feeling sometimes that things aren't always right, and it's good to just be on top of it. Don't let it get out of hand. Be confident in what you're seeing. Sometimes we're like, oh, I didn't know if that was right or wrong, so I just didn't say anything. I didn't want to look stupid. Just be confident in what you're seeing, and use your gut. Weigh the risk and benefits. Obviously, we do that in everything we do. Be patient with yourself. Be patient with the people you're working with, fellow nurses, your patients, your CNAs, perhaps. It's grueling, but you're all in it together, and you need to be patient. Sometimes just take a step back, take a deep breath. It's fine. Be knowledgeable about your own beliefs and values. Be creative, and be realistic about expectations. We all set the bar pretty high for ourselves, I think, and we try to be the best and make the best decisions, which is good, but we can't always be perfect. We are going to make mistakes. I've learned that. We can't always be perfect, and that's okay. Don't beat yourself up about it. Alright, ways to improve critical thinking. So evaluate your own work. If you, fill out your paperwork, do whatever you need to do, and then take a step back and let it go for a few minutes, and then come back and look at it again and say, is this right? Is this how I want to word this? Is this the best work I can do? That'll help. And then anticipate questions that others might ask you. So I know where I work, we have charge nurses, and when we bring things to them, they always ask questions about, patient status, what have you. We think somebody has pneumonia, they're going to ask, what are the lung sounds? What's their temperature? What things are you seeing? So I always try to think of, okay, what questions is she going to ask me when I take this issue to her or the doctor? So try to always have all of your data together so that when these questions come up, you can you can give them the right information. Always ask questions and seek out information. If you don't know something, don't be afraid to ask. And that's how we learn. That's how we're going to gain that experience that we need to make better clinical decisions. Learn from your mistakes. Like I said, we all make mistakes, and it's a great way to learn, and you definitely remember things the next time they come around. Try to keep an open mind to the ideas of your coworkers. We've talked about that too. Um, you all need to, put your brains together and try to make the best decision for your patients. So then I listed my references, and my question for all of you is, do you feel like you struggled with critical thinking after graduation from an ADN program? And how did you overcome these struggles? Thanks.